Hi there and welcome back to Dr. Carri's Clinical Corner. And today we're going to talk about pelvic pain. So this video is going to be kind of an overview of the different types of pelvic pain that we treat in pelvic floor therapy. And then I'll make subsequent videos going a little more in detail of each specific thing. So oftentimes I think as a pelvic floor therapist, when I think of pelvic pain, I think internal pain and more for women vagina owners than men, and like painful sex or pain with penetration or pain with vaginal exams, you know, like at the OB. And that's definitely a major thing that I work on, super common thing I see in the clinic. But there's also a couple other kinds of pelvic pain. So I see a lot of people that have pain with sitting. This can be male or female. I see people with tailbone pain, so that is a little bit more specific and different, but also sort of in the realm of pelvic pain. And I'll tell you, like, my people with tailbone pain, like, we generally don't do internal stuff. I mean, we don't do it if anyone says they don't want it. But a lot of, like, if you're having pain with penetration, like, we probably got to work on where the pain is. But tailbone pain, I find much more success working externally, like on the outside, over the clothes, like super, I mean, we're in there, but we're in close parts, but nothing internal, not even getting undressed for most of my clients. And then also there's sort of a category of pain with peeing, pain with pooping. So pain with peeing can be like interstitial cystitis. That's a really hard word to say. Or like now they call it painful bladder syndrome. And so sometimes physical therapy can help with that. I think that's sort of a multidisciplinary thing. We got to look at a bunch of factors. Or pain with pooping, like if you have chronic constipation or hard poops. And we can treat even children with this, or adults. I don't treat a lot of children, but I've taken the classes to treat them. But some of the stuff I learned in my classes for kids, I use with adults. So yeah, you can have pelvic pain with any of those scenarios. And yeah, and depending sort of on like what is the cause of the pain, then that will dictate how we treat it. So check out the following videos. If you're watching this the day it gets posted, these probably won't be up yet, but in the next videos, I'll go in depth into all of these different types of pain.